a coalition of 19 Democrat-led states, along with Washington, D.C., has filed a lawsuit against the Trump administration, challenging a new declaration from the Department of Health and Human Services that targets gender transition treatments for minors. The lawsuit was filed in federal court in Oregon and names HHS, Secretary Robert F. Kennedy, Jr., and the agency's Inspector General. At the center of the dispute is a declaration released last week that labels puberty blockers, hormone therapy, and gender-related surgeries as unsafe and ineffective for children experiencing gender dysphoria. The declaration goes further, warning doctors and hospitals that they could lose access to federal health programs like Medicare and Medicaid if they provide these treatments to minors. That warning alone has already caused concern across the medical community. This move builds on President Donald Trump's executive order issued in January, which directed HHS to protect children from what the administration calls chemical and surgical mutilation. Speaking at a press conference, Secretary Kennedy said the administration is taking what he described as decisive action based on science and the president's order. But the states suing say the declaration crosses a legal line. New York Attorney General Letitia James, who is leading the lawsuit, argues that a federal agency cannot change medical standards by simply posting a document online. She says decisions about medical care belong in doctors' offices, not in political declarations. The lawsuit also claims HHS violated federal law by skipping required steps like public notice and public comment before making such a significant policy shift. According to the complaint, the declaration pressures medical providers to stop offering care without following proper legal procedures. The declaration relies heavily on a department report released earlier this year, which questioned existing international treatment standards and raised concerns about long-term effects and consent. That report has been sharply criticized by major medical groups and physicians who treat transgender youth, who say it misrepresents available evidence. HHS has also proposed new rules that could block federal funding for hospitals that provide gender transition treatment to minors. Those rules are not final and cannot be enforced yet, but they signal where the administration is headed. Since President Trump returned to office, several major hospitals have already scaled back treatment for minors, even in states where the care remains legal. Meanwhile, the Supreme Court's recent decision upholding Tennessee's ban has strengthened similar laws across the country. This case now sets up a high-stakes battle over federal power, medical authority, and the future of health care policy in the United States. What is your thought? Write your comment below and don't forget to like and subscribe.